The increases that we're asking for are absolutely necessary for a number of reasons. One, state law requires Blue Cross's lines of business to be what's called self-sustaining over time. Last year on these products in the individual market, we lost $94 million, which means that we have to go back to the insurance commissioner and ask for rates that reflect our cost. We want to do this in light of the economic conditions. We want to have respect for what families are facing in Michigan now, with more of them losing their group coverage. So we've decided to go back and ask for rate increases. However, the rates that we're asking for are less than what we actually need to break even. So we expect to continue to lose millions of dollars on these products, but we have to go back and ask for something more. This isn't driven by profit for the Blues. The Blues actually don't make a profit on these lines of business. Last year, in 2009, we lost $94 million on these products. With the rates that we're asking for this year, we expect to lose between $40 and $60 million. This isn't profit-driven. It's driven by a need to have rates that are commensurate with the medical costs that we're facing as an organization. We need to be able to continue to pay out for the health care that our members receive in a way that doesn't pull us under as a business. The rates that we're asking for affect policies that are carried by about 200,000 people in Michigan who are under age 65, who are covered as individuals, who aren't covered by employer group plans, but who buy their coverage on their own. We're looking for these rates to go into effect on October 1st, and that's what we ask for in our filing. We expect and hope that the process will conclude by then because we need to increase the premiums in order to keep up with increasing medical costs that are affecting the organization. The reason that we have so much pressure in the individual market and we're losing so much money in the individual market is due to a regulatory system in Michigan that allows commercial insurance companies to reject people who have pre-existing conditions, who are more costly to cover, and have Blue Cross be virtually the only insurance company in Michigan who will cover these folks. So what that does is it makes the cost of our individual pool that much more expensive because we're covering people who have cancer or who have heart conditions for which they are rejected. They come to the Blues, we're happy to cover them, but it makes the cost of health care more expensive, and that expense is reflected in our premiums. And the rising cost of medical care has affected how we price our products, and unfortunately we've had to go back last year and again this year to ask for premium increases in order to keep up with rising medical costs. Blue Cross publicly publishes its rates for individual coverage, and as part of its rate filing process, the rate increases that we ask for are very transparent to the public. Medical loss ratio simply refers to the medical expenses that are paid out by an insurance company in relation to the premiums that that company takes in for its plans that it offers. Here in Michigan, in the individual market, Blue Cross's medical loss ratio is above 100%, which means that we pay out more money than we take in customer premiums. It's interesting that the national healthcare reform legislation that was just signed by the president mandates a loss ratio on insurance companies of between 80 and 85%. Here in Michigan, Blue Cross's loss ratio is well in excess of that in the individual market. It's 105%.